Hello everyone, this is Jin, a TCM practitioner and instructor in Victoria, BC, Canada. Here is my online class for Pathology. This class is specially for TCM students. The book we used I put below here. I hope I can help the students to study and review for the class. Okay, let's start. So then we go to the next one. Next one we say that congestive heart disease. Congestive heart disease that means the patient has some heart issue just after birth. Then we find it. So these have a lot of different types. And the heart is gradually development, and usually is on the pregnancy week 3 to week 8. Some heart like a form is formed already. We still not totally know what caused some people their heart have congestive kind of disease. But truly some environment reasons and some infections or maybe chemicals can cause that problems. And maybe moms have some illness like diabetes can cause that problems. So that look like a pretty sad when baby coming and then they have congestive kind of heart disease. But it truly happens. So when we're talking about congestive kind of heart disease, basically we're talking about like blood flowing problems. So we know normally blood flowing, left side and right side is totally separate for the adults. But for the congestive of heart illness, their blood flowing is kind of connected in different part of the heart, or maybe in bigger big artery connected with vein. So kind of different kind of blood flowing. So we separate with like different patterns for congestive kind of heart disease. So blood flowing, normally we say left side, right side is totally separate. But when they, for some reason, connected some way, that's possible happens, like blood flowing from left side to right side, or maybe from right side to left side. Let's talk about blood flowing from left side to right side first. So that's the mainly common type in the congestive kind of heart disorder. Blood flowing from left side to right side. They still including the different type. They still including the different type. They have like a artery separate, and they may have like a ventricle separating. Some disorder there. And they also have Pathology dark artery is not closed there. Let's talk about the different type one by one. The first one we talk about the atrial separator defected. Yeah. So that means, so we have ventricle, we have atrial. So we have 4 chambers. That's the part atrial. Yeah, that's part atrial, something behind it. Yeah, that's left atrial. That's right atrial here. So normally it's separate, but for some reason, they have some community in there. So I like to say, we know when baby in mom's uterus, they don't use their like the lung to breathing. So their oxygen all coming from the mom's blood circulation. So in that kind of case, yeah, their lung not working in that time. So originally, like all the babies, they will have a community in here because they are not truly use their lung take oxygen. So blood circulation from the mom and then go directly sending to all over the body. That's because during the pregnancy, the baby don't need take oxygen by itself. But this hole will be closed very soon after baby delivery. So usually like a couple weeks, yeah, it will be closed. But later, not more than 6 months. So usually maybe a couple days, maybe a few weeks, they'll be totally closed. So still have some baby, for some reason, the hole not closed. So that causes problems. The blood from left side of the ventricle go to right side, atrium, left side atrium go to right side atrium. Yeah. So because the pressure on left side usually is higher than right side. So that's pushing from left side to right side. So basically we're talking about it's left side to right side, the blood flowing. They separate with 3 different mainly, we talk about mainly. One is like a hole between the left atrium and the right atrium is hole there and the blood flowing mainly from left side to right side. And also possible in the ventricle part, in the ventricle part, you can see pretty clear here. There's a hole in there and still mainly blood flowing from left side to right side. And some other possibles is connecting from the aorta. Yeah, so that's big blood vessel, aorta, and connecting with pulmonary artery. Yeah, pulmonary artery. So that kind of flowing. So we say blood flowing mainly, yeah, mainly is from left side to the right side. Yeah, mainly to the left side to the right side. But still possible, like both right side to left side also kind of community in there. So how severe the clinical symptoms? Like some case, they just birthing, maybe the parents didn't find their heart have some trouble, and even their doctors didn't find their troubles. So it's depending like how big hole in there. And also we're talking about some patient or some case, they may be later on gradually, like totally closed later.
So basically, if the hole not closed until 6 months, they may need surgery to treatment. But the case still have like 6 months to fix it by itself. Truly, if not fixed later on, like they don't have enough oxygen, and they will cause the severe kind of problems, like short breath and pretty tired, poor development, poor nutrition. So lot of problems relationship, because that's a pretty big issue. If their left side heart blood flowing couldn't separate with the right side blood flowing, that's pretty severe issue. So that's about congenital kind of heart disease. We just go to some 3, like typically, specially, but truly they have more pattern than this. But basically idea is kind of blood flowing couldn't separate.